Enoch Akowuah and Mike Gibson coming to you live from ACC 2023, and we are talking about the UK mini trial. Tell us what you did, Enoch.
Hi, Mike. As you know, there are two ways of repairing a mitral valve: a conventional sternotomy or a minimally invasive thoracotomy. And for a long time, there's been great debate in the surgical community about which of these approaches is best. And importantly, patients really like the mini thoracotomy, but they have a couple of questions about it. Well, three really. A, can you repair as many valves through that small incision? B, will that repair be as durable? And C, is it as safe? Is having a longer complex operation as safe as a conventional operation? So what we did was the first and the largest randomized controlled trial to compare the two techniques. And importantly, we randomized patients to a minimally invasive expert or a conventional expert. So it's an expertise randomized based trial. And the experts had to have done a minimum number of cases, and that was then adjudicated by the trial steering committee to allow them to be an expert. It did mean that patients had to move from surgeon to surgeon. So if your surgeon was a conventional surgeon, but you were randomized to mini, you'd have to leave that surgeon and go to a different surgeon. So that was the complexity, but that was really important to account for the learning curve. The primary outcome was also very much focused on patients. So we asked patients, what's going to be the thing that makes you choose one operation over the other? And the patients said to us that once I'm assured of expertise, the most important thing is how quickly I get over my surgery. So my return to my usual physical function and usual activity. So that's the primary outcome. And we measured that difference at 12 weeks. So in summary, expertise-based randomized controlled trial comparing mini and conventional with a difference of physical function measured at 12 weeks. So that's what we did.
And what did you find?
Well, we found that the primary outcome was not different between the two groups. So at 12 weeks, the difference in the physical function from baseline was the same. But we found some important secondary outcome differences between the groups. The most important being that at 6 weeks, patients who have conventional sternotomy have had no change in their physical function compared to baseline. So they don't really benefit from the operation up to 6 weeks. And between 6 and 12 weeks, you get this accelerated increase in physical function. In patients who have mini surgery, they're significantly different at 6 weeks. So at 6 weeks, they're already over the operation. And at 12 weeks, they then catch up with they're the same as a conventional patient. So what we found is that essentially mini stenotomy patients get better quicker after surgery, but that difference is only seen at 6 weeks. By 12 weeks, they're the same as everyone else. The other key thing we found was to address the other questions about can you repair as many valves? And the answer is yes. So in both groups, over 96% of valves were repaired. And that's the range of all valve pathologies. And then the other questions, are the valve repair as durable? And we found that that was the same. So 95% of patients have no or mild MR at 12 weeks, and 92% have no or mild MR at 1 year after surgery. So we think we've answered some of the most important questions about these two operations.
So let's take a message. If you were a patient, which one would you want?
Yeah, that's absolutely right. So we haven't talked about some of the other secondary outcomes. So for example, we measured physical activity using an accelerometer, and we saw that patients in a mini group were spending more time doing moderate or vigorous physical activity at 6 weeks. We also saw that they had much better sleep efficiency all the way up to 12 weeks. So what we've shown with the secondary outcomes predominantly is that it's a better experience having a mini operation. You get better quicker, your physical function improves quicker, your physical activity improves quicker. But at 12 weeks, there's no difference between the two groups. So if I was a patient, I'll definitely have a mini stenotomy. The other thing we showed was that length of stay is much reduced with a mini stenotomy operation. So 30% of patients go home within 4 days of surgery, and that's only seen in about 15% of conventional patients. So the data suggests there's better experience for patients who have mini early after surgery, but after 12 weeks, there's no difference. So I think if I was having an operation, that's what I will have. And I think that what we hope this study will do is to encourage clinicians to take up this technique, because we've shown for the first time that it's just as safe, it's just as effective, and the valve repair is just as durable if you use a minimally invasive approach.
Wow, great stuff. Keep up the great work. Look forward to hearing more from you about maybe the cost effectiveness and all the other ancillary sub studies. Keep up the great work. Thanks for joining us, and thanks to all of you for joining us here live from ACC 2023.
Thanks, Mike.